our lab is focused on genetic epidemiology and epidemiology as a whole. So we don't really delve into the mechanisms, but we do understand some of them. And basically, it's very similar to what happens with the heart, right? I think that as scientists, we have always, and as doctors, we have always focused a lot on the heart and on trying to understand how these risk factors affect the heart. Well, they affect the brain in a very, very similar fashion. So what we understand as this basically chronic stress, right? That poor cardiovascular health, we can imagine high blood pressure with the sheer stress affecting the vessels. We can imagine obesity and high BMIs with the chronic inflammation and the inflammation biomarkers that go on slowly and insidiously until, the damage is being done over and over the years. We can think of the same thing when we're talking about blood glucose and blood cholesterol, so atherosclerosis, and all of the also chronic inflammation that comes with high blood glucose levels in the blood. The same way that affects our vessels, our coronary vessels in our heart, or our vessels throughout our body, that also affects our vessels in our brain. So, of course, this is the most important thing involved with stroke, but also dementia and late-life depression. So dementia, of course, we have this the vascular subtype of dementia, which is very, very strongly linked with, of course, stroke and with cardiovascular risk factors. But poor cardiovascular risk factors have also been associated, like in a third of Alzheimer's disease cases. And going to depression, this subtype of depression called late-life depression that's being known for a while, but it's gaining traction nowadays. It's because it has been really, really shown to be different than the more common type of major depressive disorder that we may think about. Not only because of the age that it affects people. When one thinks about depression, one thinks mostly about younger people, right? The same way that one thinks about other psychiatric conditions like anxiety or bipolar disorder. But that doesn't mean that older adults don't suffer it, right? And this is a specific subtype that tends to affect people older than 60 or 65 and has specific symptomatic patterns and signs, right, that are different. For example, it has more impairment on cognition. Even though it's not dementia, patients may have more difficulty with cognitive tasks or with executive tasks, right? And also it has been shown to really link with cardiovascular health. So usually people would have more cardiovascular risk factors, they would have hypertension for longer years, et cetera, and et cetera. So yeah, I think we still don't understand everything, but we're trying to do our best to link all of this together.